Now, how many times have you felt the urge to pass urine but decided to hold it because the time was not appropriate or there was no washroom facility close to you? Well, prolonged holding of urine has its health consequences.
When you hold on long, the urine will remain in the bladder for longer than necessary. This gives ample time for bacteria to climb into the bladder, and such people are at risk of getting recurrent urinary tract infections. So the healthy thing would be to continuously pass urine.
The longer one is pressed without relief, there are increased chances of catching an infection. The body uses the urinary system to flush out waste products, but if the waste is continuously retained, it can become toxic or poisonous, putting you at risk of a urinary tract infection.
When it happens, that means that the waste products that are normally excreted or removed from the body through that route are going to be retained. And once they retain, they are toxic to the body, they are poisonous to the body, and the body is not going to function properly, and somebody will become sick.
A urinary tract infection, or a UTI, is an infection that can happen anywhere along the urinary tract. UTIs have different names depending on what part of the urinary tract is infected. The urinary tract is composed of kidneys, the bladder, the ureters, and the urethra. Any of these parts may get an infection.
You can also have infections of the bladder, you can have infections of the ureter, and these are common things that we see that cause disease in the urinary tract.
Urinary tract infections are caused by germs, usually bacteria, that enter the urethra and then the bladder. This can lead to infection, most commonly in the bladder itself, which can spread to the kidneys. Not emptying your bladder completely can also expose you to risk of catching a UTI.
Women are talked about in particular because their urethra, or the external conduit through which the urine goes to the outside, is short. So the bacteria easily climb a woman's urinary tract than a man's urinary tract, which is longer. So it takes a longer distance and time for the bacteria to climb a man's urinary tract as compared to a woman's urinary tract.
Many people may not know they have a UTI, as most times the body can clear the infection on its own. But symptoms may include cloudy or bloody urine, which may have a foul odor, pain or burning with urination, pressure or cramping in the lower abdomen or back. Other symptoms include a strong need to urinate often, even right after the bladder has been emptied. Low-grade fever may sometimes accompany these symptoms. Although UTIs are uncomfortable, treatment is usually successful. Symptoms of a bladder infection usually disappear within 24 to 48 hours after treatment begins. For a kidney infection, it may take 1 week or longer for symptoms to go away. Some people have chronic urinary tract infections that may need antibiotics for many months or stronger antibiotics to be prescribed. But lifestyle changes can go a long way in preventing some UTIs.
People should be clean in their environments. They should wear clean underwear. They should eat clean food. They should be in a clean environment and expose themselves less to the bacteria and other agents of infection.
Doctors also advise women to avoid douching and using feminine hygiene sprays, avoid bath in favor of showers, wipe excreta from front to back after using the bathroom, and keep the genital area clean, especially before and after sexual activity. Urinating before and after sexual activity also prevents UTIs. However, some urinary tract infections, such as tumors and cysts, cannot be prevented and may be caused by a variety of reasons. Anna Tkunda, NTV.